Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Sydney, welcome to the show.
Hi, I'm so excited to be here.
I'm so excited to have you, and I'm very excited to dive into this topic because I think it is one, like you said before we started recording, it can feel a little bit hard to bring this up to your medical staff. It may feel a little taboo. It may feel like, oh my God, I hope I don't make them mad, or I don't want them to think I don't trust them. I don't want to come off as that patient. Like, I don't want to be annoying or like too much. So, birth plans and medical staff and advocating for yourself when it comes to your preferences around labor can feel sticky. So, I'm really excited to dive into this conversation. And I think a really great place for us to start is probably just the elephant in the room.
Mm-hmm.
Do labor and delivery staff hate birth plans?
No, they don't. I think a lot of people think that we do. We hate them when someone comes in with a long birth plan that we're just like, oh my goodness, this person is not going to get anything that they want. That is not true. Okay. Majority of the staff actually love birth plans, myself included. I think it is a fantastic tool that can be used while you're in labor and delivery to help educate your care team on what you really want from your birth. Of course, there's going to be certain staff here and there who don't necessarily agree, but that doesn't matter. It doesn't matter. At the end of the day, you're there to advocate for yourself and what you want. So show up proud with your birth plan, and majority of the team are going to be supportive of it for sure.
And if you get paired with a nurse or a provider who doesn't like birth plans, can you expect them to come right out and say it? Oh, no, I just don't want to work with a birth plan. Or do we sometimes see maybe covert things happen where they're just a little begrudgingly going with your birth plan, or they make snide remarks? What do you most commonly see when it comes to people who maybe don't think about birth plans like you and I do?
Yeah, and I think majority of the people won't necessarily be like, "Oh, I don't believe in birth plans" straight off the
Sure.
bat. They're not going to say that. It's going to be more of the, "Oh, this might not necessarily happen," or with our hospital policies, we don't do this and this. And sometimes that's a good conversation to have. What can be expected at the hospital and what can't be. But sometimes there will be some snide remarks. And I always remind my patients too, and remind everyone online, that you do have the right to ask for a different nurse too. So if that's something it's not a good fit and you're noticing those comments, you can ask to speak to the charge nurse and have a little switcheroo, and that's okay. So keep that in mind as well.
Yeah, I recently had a post go viral where my team and I acted out heading to the hospital, calling ahead and saying, hey, I would like this type of nurse. So if you have something on your birth plan where it's like, I really prefer to be upright, or I really prefer to birth unmedicated, whatever it really is, I really prefer a nurse that is soft spoken and respects like a very gentle atmosphere in the birth space. Ask for that when you call the hospital to say, hey, we're coming in. Also, can we have a nurse that, and then fill in the blank of whatever you want. That's a really good tip. And we've had some clients have really good success with that and got partnered with like angel nurses that just made all the difference.
Yeah. And at the end of the day, not everyone's going to fit perfectly, but
Totally.
we will try our very best. Like I can say at the hospitals I've worked at, like the charge nurse is always wanting to assign the patient to the nurse that they think will fit best and be able to support the patient the best. So for example, me, I love birth plans. I love a good unmedicated delivery. I love being there and supporting women through that. So if there's someone who comes in and is, I really don't want to get an epidural, I have all these mechanisms in place, the tools I want to try, they usually give the patient to me, or they'll be like, hey, I think Sydney would be a great fit. And there's other nurses who they might choose to fit with certain patients as well. So we try our best to do that as long as there's not 1,000 patients on the board and as long as it's not too busy. But majority of the time, we're able to fit the patient with the nurse in a way that will feel right for them. So
I
yeah.
did not know that. I had no idea that charge nurses were very intentional on how they were assigned. What kind of things are we looking at to make sure that we're assigning patients and nurses accordingly if we can and we have the staff to do?
Yeah. So if for us on in the side of like how acute is the patient? So if they are a low risk delivery, they're coming in, they don't have many comorbidities or any other health concerns that we're worried about, then we will usually give them to someone who's maybe a little bit less senior, which means that they don't have as much experience. And then if a patient has a lot of comorbidities or they're trying to have a VBAC, so vaginal birth after a C-section, that does put you at a slightly higher risk. So we might put you with someone who has a little bit more experience with laboring someone who's had a C-section prior. So there's just things that we have to think of as your medical team just to make sure that you're getting taken care of in the best way possible.
Oh my God, I did not know that. I find so
Yeah.
much comfort in that. And I think a lot of people think it's random. I knew it wasn't random. I knew other things like patient ratios and yeah, that predictive, all right, what if this happens? Or like we're planning for a new moon, a full moon, or we're planning for a
Yeah.
snowstorm, or like it's RSV season, whatever it might be. I knew that it wasn't random, but I did not know this much intention went into it. And so it makes me so happy. My heart like feels very full from that.
Yes. And that's another thing with the patient ratio. So for us, it has to be one-to-one nursing care if someone is on Pitocin. So
Oh.
if a nurse already has a patient in triage that they're assessing and thinking about maybe they might end up being admitted, then we probably won't be giving them a patient who is on Pitocin because that should be one-to-one care. At least here in Canada. I'm not sure if other areas in the world it's a little bit different, but here it's one-to-one nursing care because that is a high risk drug. So
Sure.
yeah.
Wow, that's incredible. Okay, so when do you think is the best time to bring up a birth plan to your provider? It probably shouldn't be in labor. However, the caveat there, the like tricky part is the people caring for you in labor most likely have just met you that day. So you do want to bring it up in labor too. So talk us through that conundrum of do I bring it to my prenatals? When do I bring it in my prenatals? Now I have to introduce it to my doctor and my medical staff when I'm in labor. What do we need to know about that?
Yeah, I always recommend bringing it to your prenatals because it's not going to hurt. At least they can help you even to build it a little bit too. So they can say, we offer this at our hospital, or we don't offer that, or here's some things you might want to include on your birth plan versus not include, and just guide you a little bit if your provider is willing, which majority of them are. I
Yeah.
know some OBGYNs that I work with, they actually go through the birth plan and highlight things, or they'll actually cross things off when they know we won't be able to offer that. For example, just a quick example, at my hospital, we don't offer oral vitamin K. Something on there, then they will cross it off and just have that conversation ahead of time, which is helpful because if you're coming in labor, you're not in the headspace to be able to think those things through, right? So it's better if you have the chance to be able to discuss that with your provider ahead of time. But if you don't and only happen to really make your birth plan in the last couple of weeks, which is totally fine as well, bring it with you, bring a couple copies with you to when you come into labor. Also, I would recommend sharing it with your birth partner or whoever you're planning to be there with you. That way, if you do come in when you're in active labor and you're not necessarily thinking straight because you're in pain and you've maybe been up for hours and hours, have them there so that they can explain the birth plan to your nurse or whoever's there to help support you. That way, if they go through the birth plan, they're like, oh, we don't do this, or I don't know if we're going to be able to offer you this, that they can at least say, okay, that's fine, but we would really like this to be included instead, just to have that conversation on your behalf as well.
Yeah, good point there. And it's not you guys like printing it out and handing it to your partner. You really should dedicate some time sitting down and discussing the things that you want. I find that partners are so much more open and confident to advocating for you in labor when they not only understand what you want, but your why behind it. I want to be unmedicated because X, Y, and Z. I would like to get my epidural as soon as possible because X, Y, and Z. I want this type of nurse or this type of birth or to birth in this position because, and then your partner understands, oh, here's how I can help our medical staff understand why we're making the choices that we're making. And it takes a little bit of that feeling of, oh, I don't want to be that patient that's always saying we're doing things different, but helping people understand your why is really important.
Exactly. And making sure every person that's involved in your care understands why you want these things. If you have a doula, talk to your doula about everything that you want prior to you actually arriving to the hospital. I always say, like, preparing ahead of time is going to be your best friend, just because when you are in active labor, it's really difficult to be able to think properly because you're tired, you're in pain, it's a lot, and you don't want to have to worry about those things at that particular moment, if you know what I
Yeah.
mean. Yeah.
Yeah. Okay. So if someone wanted to share their why with their nurse,
Mm-hmm.
how would they go about that conversation? How do you think they should grab their nurse? Sometimes it can feel like you guys are really busy, and it is sometimes hard to interject ourselves and be like, oh, can I grab you? Because you have so much to do and we can tell y'all are busy. What do you suggest in like approaching your nurse and just explaining, hey, I might do things a little differently than what you are typically used to. I wanted to let you know why I'm making these choices.
Yeah, and I find a lot of people say, "Oh, I don't want to bug you. I don't want to bug you." But this is our job. At the end of the day, we're here to help you. So just keep that in mind. It is okay if you interject us and you're like, "Hey, can I grab 5 minutes just to go over what I want?" And if you say it in that way, we will 100% be okay with that. I don't know any nurse who would be like, "Actually, no." Or we might be like, oh, I have to go run and do this one thing, but I'll come right back and then we can have this discussion. And I think that's a really easy thing to do. What I would say is the best time to do it is when they're admitting you. So when you're going through the admission process, this is a really good time because we're usually going over your whole history. So we're going over your pregnancy, any other health concerns you've had, if the baby's had any concerns. We're going over who your doctor is, who your family doctor is. We're going over all of these necessary things that we need to know. And we're usually writing it down in your chart. And we have what's called like a Cardex or a face sheet that has all that information. So that would be a really good time to say, hey, I also have my birth plan. And you can present it and just be like, you guys can keep it. And what we usually do with that is we either photocopy it, or if you have other copies, we'll just take it. And then we put it right next to that face sheet so that anyone who has your chart can actually see that there's a birth plan right there. And sometimes I'll even highlight some things that are really important to you, and I'll just go through it with you at that time, the admission process. I feel like that's the best time to do it, especially if you're more in the kind of earlier stages of labor. You're not in that. Some people come in and they're almost fully dilated and pushing, and at that point you try your best, but it's still
Time is of the essence.
exactly.
Oh
Yeah.
my goodness. Okay, so I guess the next question is what other tips do you have for making your birth plan? Like what kind of things should we be thinking about when we sit down to actually put together our preferences on what we want? Let's say we've already had the conversations with our provider and we've already thought about it. We're sitting down. Now what do we think about?
Yeah, I find that a lot of people include a large amount of medical information.
Mm.
I don't find that to be 100% necessary, only because we do have all of your medical information. Like your care team should have all of your past history, all of your past ultrasounds, all of your antenatals, we call them. So we have that information. If you want to put like the main things like allergies or medications you're taking or your group B strep status, those kinds of things you can put in there. But for your birth plan, we want to focus, like you said, on more of your preferences. So what is your ideal delivery? What does that look like? Is it a water birth? Is it a C-section, a scheduled C-section? Is it what kind of birth really speaks to you? And include that in there. Another thing I would include is if the baby's gender, because some people want it to be a surprise, and somewhere in your chart it might say this is a baby boy, and then someone might let it slip right at the end, and you want to keep that in there. I feel like that's a special moment if you're keeping the gender a surprise. So I would put that on there too. And then also include your support people. So like I said before, if you have a doula, put their name on there with their contact information, and then have your birth partner there as well, or your mom or your sister, whoever is going to be there with you and who you're okay with being in the room with you. Have that information on there as well. That way we can call them on your behalf, or just so that we know who is there and who's not. Because we get a lot of patients, or a lot of visitors, I should say, at the nursing station who are like, I'm here to see so and we're just like, okay, we're going to go check with the patient to make sure that they're okay with you coming and visiting, because sometimes they're not, right? So it's good if we can know those main people that you're like, yep, I'm good if they're there. I'm happy for them to come in and out as much as they want. And then some other things to include is just what you have in place for pain management, because we know labor can be painful. So what kind of things have you thought about that you want to do? Are you open to an epidural? Are you not open to an epidural? Have you thought of laughing gas or nitrous oxide? Is that something you're open to trying? Hydrotherapy, so water, like bath, shower, do you want? Because this is a whole other thing. Some hospitals don't actually have a bath or shower in every single room, which I know is terrible. Every room should have one, but some places don't. So if you're really interested in having a bath or a shower for that hydrotherapy, we'll actually put you in a room that has that, if that's something that's on your birth preference list as well. So that's something really good to include as well.
Okay, that is so helpful to think about all of that. One thing that came to my mind when you were like, is it okay if this person comes in? What about people you want to keep out? Is that something to tell your nurse? Like, hey, my mother-in-law, like, if you see her, do not let her in. Or, hey, my own mom, my sister, whatever it might be. Yes.
100%. And I'm okay to be the quote unquote bad guy and be like, we're only allowed this many people in the room. And if I need to send grandma to the waiting room, I will 100% do that. So that is a really good point. If you want to include the people who are you're okay with, or the people who you're like, I don't know if I want them in the room, can you maybe just tell them that our visiting hours are over or something like that? And we will do it for you 100%.
Yeah. Nice. Nice. Okay. All right. What else? I feel like you're just like giving us so much information. Keep going. No, I don't want to interrupt. Keep going.
The other thing you want to include is like environment. So do you want dim lighting? Do you have music? Did you bring a speaker? Do you have your own birth gown that you want to wear? Other things are like if you're okay with students or learners, because that's a huge thing as well. A lot of hospitals have some residents or medical students that come in. Are you okay with that? Do you prefer an only female provider? That's something that we can try to accommodate. We can't always accommodate because it's based on who's on call. But if you would really prefer female providers, sometimes we can make that work as well. So that's something to really think about. And then for the actual labor, have you considered what kind of monitoring you're okay with? Do you want the baby's heart rate monitored at all times, or do you prefer to be off the monitors as much as possible? So that's something that you can think about, and your care team will talk you through that as well, because there's certain situations where we'll need to monitor the baby at all times. For example, if you're on Pitocin, that's one of those things where we'll have to keep you on the monitor, but that's just something to think about. And what kind of ideal situation you would want for pushing. So do you want to be coached on how to push, or do you want more of that, what's it called? Not purple pushing. I'm forgetting what it's called. The type of pushing where you're like, open glottis pushing, where you're listening to your body and you're just like breathing through it. Or do you want to be coached through it? That's something that some people don't actually think about, because a lot of people are like, I don't know how to push and I need you to walk me through it. Or actually, I want to just listen to my body and follow my body's cues on how I should push. Some people also come in and they're like, I really want to try the squat bar to push, or I really want to be on my hands and knees, or I really want to be in this particular position. That's a good thing to put in on your birth plan too, because then when it comes time to push, we'll get that equipment ready, because sometimes the squat bar, it takes a little bit of time to go grab and put in, so we can have that ready and we'll be thinking about it so that you don't have to. And then another thing I usually like to add in is that a lot of people don't think about postpartum when they're doing their birth plan. And I feel like postpartum is still an essential part of your birth plan. So thinking about that first 24 hours with a baby, are you interested in breastfeeding? Are you not interested in breastfeeding? Have you collected some colostrum that you've stored? That's a really good thing to have on your birth plan, just so that your team knows, okay, we have some colostrum that we can go grab, or they already know how to hand express because they've been doing it for the last couple of weeks. And again, that eye ointment, the erythromycin eye ointment or antibiotic ointment, is that something that you want? Is it something that you don't want? The vitamin K injection, that's another really important thing. And then if circumcision is something you're wanting, that's something to put on there as well. And the 24-hour bath. So usually we recommend waiting 24 hours before you bath your newborn, but some people want their newborn bathed right away. So this is again, or they might actually not want the newborn bathed at all and they want to do it at home. And that's fine too. So that's just something to maybe include on there. And just what kind of supports you have in place for postpartum. Do you want to see a lactation consultant? Do you have a history of anxiety or depression? Because that does put you at a slightly higher risk for developing postpartum depression, anxiety, all that kind of stuff. So I feel like it's a really important thing to include on there. And don't forget to include C-section on there too, because there's two ways to have a baby, right? It's through the vagina or it's a C-section. And I think it's important to have listed on there your preferences for worst case scenario, things go south and you need to have a emergency C-section. What exactly can we do to make that experience a little bit more comfortable for you? So is there a clear drape available if that's something you want, or you really don't want a clear drape, you don't want to see anything at all? Who would you like in the room with you? Because usually you're only allowed one person in the room with you. So who is that one person going to be? Do you want to do skin to skin in the OR? Do you want music? Because a lot of places we can actually play music as well in the OR. And delaying newborn measurements, all that kind of stuff, we can wait. We don't need to do it in the operating room. And we can even start feeding in the operating room too, if that's something you're interested in. So there's all these things that you can look up, research, think about. I know you don't want to think about a C-section, but it's important to just have it on there, okay? Because I think a lot of people avoid it entirely. And then if they do happen to have a situation where they're in an emergency, they're like, oh, these things would have been nice to have, but I didn't even think about it.
Yeah, now we're cooking with hot sauce and getting into some
I
sore
know.
spots of where people don't really want to venture. You guys, I
Exactly.
could not agree more, like
Yeah.
more with you, Sydney. It is very uncomfortable to think about outcomes of your birth that you don't want to happen. I
Yeah.
get it. I totally understand. You don't want to have a surgery for your baby. But
Right.
sometimes, even in cases where we don't think it's where you're low risk, right? It's a low risk that you might have a C-section, you still want to be prepared. I love that you go over all of the things that you do have control over, because a lot of times a C-section feels very out of control. So to know, okay, this is not what I wanted. I wish things had gone differently, but I still have control over these things will bring people a lot of comfort if you find yourself needing some sort of cesarean procedure.
Exactly. And another thing that people usually don't think about is that they can add all of these things into it, like having the music playing. That's something so simple that can really make a huge difference while you're in that operating room, because it's a bright, cold, scary room that you've never
Yeah.
been in before. Having some comfort and having a warm blanket, even just like little things that you can easily control, will really help to make your experience feel a little bit better.
Yeah. Okay, what about postpartum plans? So maybe on your birth plan you put through that first 2, 4, 6 hours of what you're hoping for care. Do you think
Mhm.
there's benefit in making a plan for postpartum? And when your postpartum nurse comes in, you say, hey, this is my birth plan for postpartum. I know these things are all subject to change. We just met this little baby. Hoping they'll help us reach these goals on our postpartum plan for X, Y, and Z. Do you think that would be helpful? I don't think I've ever heard of anybody making an actual. We make postpartum plans with our clients, but they are meant to be hung on their fridge. They are not designed to be taken into the hospital. And so now I'm just having this moment where I'm like, wow, should we be making postpartum plans and sending them into the hospitals with people?
I personally think it's a great idea. I
Yeah.
also haven't seen that. I did work as a postpartum nurse for probably 6 months before I went into labor and delivery, and I never saw someone come in with that.
Wow.
I personally think it would be amazing to have that, just so that again your care team knows what you really want from this experience. And there's a lot that goes into newborn care, especially in that first 24 hours. It can be really overwhelming, the amount of information that's thrown at you. So if you can have a little bit of information on there on what you would prefer and what you wouldn't, so like if you would like the nurse to take the baby in between feedings so that you can rest, sometimes that's offered at certain hospitals. Or maybe you're like, nope, I want the baby by my side at all times. So that's something you can include on there. Or if you would like to see a lactation consultant, if that's offered, because most hospitals have lactation consultants, and I strongly recommend them, but that's
Yeah.
something you can put on there. Like you can be like, because another thing is with lactation consultants, sometimes they're only there Monday through Friday. You
And
can
only daytime hours. They're usually
handle
not
it.
evenings or overnights or weekends.
Exactly. So if you're like planning to be discharged on this day, you might want to stay a few hours later just so that you can see the lactation consultant.
That's a good
So
idea.
that's something you can put on there too, or organize like an appointment with them afterwards in the community. And which visitors, again, this is another thing, visitors, I know visitors are a huge thing, but who do you want visiting and who do you not want visiting? Because postpartum gets so many visitors. And if you're not interested in having visitors, we can again be the little bad guys and just be like, nope, visiting hours are over. I'm sorry. And that's something that you can put on your plan too. And we'll be able to help you reach those goals and hopefully feel more comfortable while you're in the hospital for 24 hours recovering from birth. So
Yeah.
I love the idea of just including some key points on your postpartum birth plan, whatever you want to call it, postpartum
Yeah.
plan or preference list. So
Yeah. Yeah.
yeah.
I think we might add that. Thinking like, how helpful would it be for parents that have very strong preferences? What comes to my mind, I think, the most is how a lot of people introduce formula, and at the end of the day, that's not really what they wanted, and it wasn't really aligned with their goals. And whether the formula was really needed or not, they never were set up with a plan on how to get off the formula because it's not what they wanted and because it wasn't their end goal. I find that formula sometimes is just introduced and it's just like, that's it. And there's no help around getting back to your original goal of maybe solely breastfeeding or pumping or doing combination feeding, whatever you chosen. But I think for me, having your preferences postpartum would lessen the anxiety that parents have on that side of the unit, because I think no one, like you said, no one ever prepares for postpartum, and then once you get over there you realize, oh my god, there's a lot of decisions that have to be made, and there's a lot of people coming in to check on me and my baby. I'm having to talk to a lot of people. I'm getting a lot of information, and I feel a little overwhelmed. A postpartum plan might be super helpful in that.
Oh, yeah. And again, what we talked about at the beginning of this is we can also pair you with a nurse who,
Oh.
some nurses have actually lactation consultant backgrounds. So if you're really wanting to make sure you're exclusively breastfeeding and that's really important to you, we can also hopefully pair you with a nurse who's going to be able to support you in that journey the best way possible. Of course, that's dependent on how busy the unit is, but usually we can do that too. So that's something to consider as well.
Same thing with like twins and C-section, things like birth trauma. Is that something that you could just tell your labor nurse, hey, I could really use a nurse that's very well versed in C-section because I was not planning for this and I feel very sad about my birth, and I could just use someone who's used to that.
Exactly. That's so important to mention and just
Yeah.
include on there. I love that idea for sure. Yeah.
Wow. Oh my God. Did we just come up with something
I
new?
think
This is
I
awesome.
think it. Well,
Oh.
it's postpartum is so slept on though, right? Because we
Yeah.
prepare so much for the birth, which is obviously still extremely important. But those first days after having a baby can be very challenging and a bit of a wake up call and something you didn't necessarily consider. So
Yeah.
really important to think about as well. Yeah.
Yeah. Oh my gosh, I could not agree more. Okay, what else? Is there anything else that we should know about making our birth plan?
Yeah, I always say try to keep it concise as possible, only because when someone is opening up your chart and they have it, the first page with everything there, it's easier to get a little snapshot of what you want if it's all on one page. So always say keep it 1 to 2 pages. It's really hard to
Hmm.
squeeze everything in there on one page, but try to do 2 pages, like maybe one page back to back, just because that way everyone will be able to look at it. And if you just show up with this 10-page document, people are going to be like, this is a lot for me to read through, and I don't necessarily have the time. I think there's a way to include it very concisely. Like you can do a little checklist style of, okay, this is what I want, or nope, this is what I don't want. There's all kinds of stuff. You can look online. There's all kinds of different birth plans. You can just make it on Word too. You
Yeah.
can literally just type out what you want, what you don't want, and just do a little checklist style, nothing crazy. Because if you make it really long, the likelihood of people reading through it decreases, unfortunately, right? Like
Definitely.
we're busy and sometimes we don't have time to go through it all. So just keep it concise and include the most important things at the very.
Yeah. There is a little piece of this that is still getting the buy-in of the medical provider, right? So we do want to do things like keep it concise, make it easy to
Yeah.
read so that it doesn't feel like a burden to the medical provider because like you said, you guys are busy. You have a lot of it. You're not there. I am not your only patient, right? Like you have multiple patients. That doctor is seeing multiple patients.
Yeah.
Oh, I just had a question about birth plan. Oh, it just went right out the window. You're busy getting the buy-in. I don't know. Maybe it'll come back to me. Yeah,
But
I
yeah,
can't remember.
I was just going to say, added into that, I think we would all prefer to have an hour long sit down review of your birth plan. We just don't have the luxury of that time. So that's why I say keep it concise. It's not because we don't want to go through everything with you. I would love to do that. If I had the time to do that with every single one of my patients, I would 100% do it. But at the end of the day, that's just not realistic for our healthcare system if you're choosing to have a hospital delivery. So, yeah.
Yeah, you bring up a good point, and this is something that I talk to a lot of people on the podcast about is the hospital at the end of the day does have rules that it's not going to be able to bend for people because of the institution that it is. And so if you go into a hardware store looking for a carton of eggs, you're not going to find it. You might be able to find a brush or a broom that has softer bristles than what you typically find, or you find a specialized type of equipment that only this store sells. You could definitely find those experiences, but you can't go to a hardware store and ask for a carton of eggs and expect them to be able to deliver on that. It's not fair for anybody involved, the medical staff, the hospital system, you as the consumer. You have to know where you're birthing.
Exactly. And I think that's a huge thing to think about when you're deciding on what is your ideal birth. What does it look like? Right. Because that's something to really think about is, do you want to be birthing in a facility that has strict policies that we have to follow as your medical team? Just something to consider as well.
Yeah. So one of the questions we get a lot is, all right, I've been diagnosed as high risk for whatever reason. I guess I just won't make a birth plan now because I don't, now I'm high risk. My birth just has to go the way it goes. What's your opinion on this? Should we still be making birth plans even though we're high risk?
Yes, I
Same.
don't agree at all with just like high risk. Okay, throw in the towel. I have no control. That's not true. You do
Yeah.
still have control over certain things. And like we talked about with the C-section, even though the C-section or emergency C-section wasn't a part of your plan, there are controllable factors that you can add that will help to make your experience better. So still go through your plan. If you already had one, you can go through it and adjust it. That's okay. Change it up. It's your first step to being a parent, and
I
just
was
know,
literally just thinking that
literally,
same
yeah,
exact sentence.
yeah, you have
Welcome
to
to
be
parenthood.
flexible, right? Like, welcome to parenthood. This is what it's going to be. You have to be okay with the things that you can't control, because that is just, that's life. And it's hard. It's challenging. I'm not discounting that at all. Obviously, best case scenario, you would have your birth plan and things would go perfectly. But majority of the time, that's not the
Yeah.
case. Things are going to go a little bit differently. And if you're high risk and you're having to change it, you wanted to have a home birth and you're no longer able to do that because of certain situations, go through your list and adjust it. Do some research on the hospital you're delivering at, talk to your OBGYN that you're now having to be involved with, and go through some things that can hopefully help to make you feel better. So little things like the environment, right? Like the music, the dim lighting, being able to go into the bathtub, having wireless monitoring. So instead of being hooked up to a machine all the time, you can have wireless monitoring. Or if you're having to have an epidural, still being able to move, or being able to have a walking epidural. Some places even offer that, or being able to turn down the epidural so that you can still feel things when you're pushing. So there's all kinds of things that you can still do if you're in the hospital environment, or things are a little bit more high risk and you haven't thought about them before. So include those controllable factors on your birth plan. I 100% think that every single person needs a birth plan. It's not something that, like, if you're even a scheduled C-section, like you're going in for a repeat C-section, you can still make a birth plan. And that's just as important.
Yeah, I agree. I would argue it may be even more important because it's one of the things that is unexpected. Like one of the best ways to give you control is to have a birth plan. So if you're headed into a known, uncontrolled kind of unexpected part of birth, go ahead and have a birth plan. It can really give you some comfort. Okay, another question that I always get is what is the importance of printing it out? Can I just have it in my head? Do I have to print it out? And I always say, like, you should definitely print it out. Having it in your head is not going to do anybody any good because eventually in labor, you're going to enter labor land or like birth brain. You won't be able to
Yes.
communicate. What's your opinion on this?
Yeah. Oh my gosh. Laborland is so true. I love that saying. I always say the labor bubble, but
Me too, me too. It's
I
a
love to
globe
say
around their head. Yeah.
it is such a real thing. It is, I see it with every single patient. It's so true. So yeah, write it down, because you're not going to be thinking straight, and probably your birth partner isn't going to even be thinking straight. So even if you went over everything with them ahead of time, it is still really important to have it written down, because it's a way that you can communicate these things without actually having to physically communicate them. And again, going back to the medical team and the medical providers, we're busy. We have a million things in our head.
Yep.
And sometimes it's even hard to keep things straight of, okay, this patient wanted this. Like, it's hard to think that through. So if we have it in writing in front of us, it's a guide. It's a literal guide for us. And it's so much easier for us to have that in place versus you like being admitted and trying to tell us all these things and we're writing it down, scribbling it here and there. It's just better if you have it printed and just given to us ahead of time. So I always say it's better to do that as well. I agree with
Yeah.
you.
Yeah. Good. All
Yeah.
right. Anything else that we need to know about making a birth plan? You've done a really great job of kind of giving us the do's and the don'ts and dispelling the myths. I think something that I've heard so many times online, I'm sure you get it too, is people being told, like, oh, the longer the birth plan, the quicker the trip to the OR, meaning that you're destined to have a C-section, right? And those
Yeah.
things can feel very discouraging and it can feel very defeating to hear those things when you're putting in a lot of work and a lot of effort to have your baby and to really be informed and to be educated and to have the confidence and find that self-assurance to advocate for yourself and have these conversations with your provider. So is there anything else that we need to know in terms of this is how you make a birth plan or this is what you need to know and like you can do this?
Yeah. I guess like the final thing I would say is just keep in mind that, or try to keep an open mind because even though you have all of these things listed and these preferences laid out, it's important to keep an open mind because, again, like I said earlier, it's the unexpected is probably going to happen, and having things in place to make you feel better during that time will be beneficial. So just keep an open mind, plan for the unexpected because the unexpected is probably going to happen, and just honestly Just let everything go and just put it all down just so that you have it ready to go just in case. And it's better to be prepared than to not be prepared and be thrown a curveball that you're like, I didn't even think about this. Always just have both scenarios. I always say, like I said earlier, there's 2 ways to have a baby and it's going to be one of those ways. So just keep that in mind. And yeah, just keep an open mind. That's the best thing you can do.
Yeah, be flexible. I always like to remind people we don't necessarily want to react to things in labor. We want to respond to them. And so we can wait and see what your body and your baby is doing and is telling us. And then we can respond to that accordingly. It doesn't mean they're going to tell us things we love. Sometimes they tell us things that we have to respond to with interventions or with unwanted C-sections, or it could be anything, unexpected diseases that pop up in the end of your pregnancy that you weren't thinking were going to be part of your story. But yeah, okay. Oh my gosh, Sydney, this has been amazing. This was such a good conversation. I love all your tips. And I think, like I said, you laid it out really beautifully about how do we approach our medical staff with our birth plans? How do we confidently share, all right, this is what I'm hoping for. How does this land with the hospital? And then how do I adjust my own birth plan based on what my hospital is and is not capable of, and also what pops up in my pregnancy or in my labor that maybe I was or wasn't expecting to happen.
Yeah. And just again, don't be afraid to mention these things to your care team. The hospital team, we're all like, we're just here to support you. So we're trying to make sure that you're safe, that your baby's safe, but we're also trying to advocate for you and for what you want. Don't be afraid to communicate your birth plan and your wishes and your preferences with your care team, because at the end of the day, we're just here to support you and what you want.
I love it. Oh my gosh. It's the end of the episodes that always give me like, in the beginning, it's like butterflies of excitement. I'm like, oh, let's get this conversation going. And then at the end, I'm always like, oh, this is why I had this person on the podcast. I love so much. But truly, thank you so much for being here. And thanks for sharing all your wisdom. And you
Yeah.
actually do awesome childbirth education online. So where can people connect with you if they want to learn from you, or if anything you said today really resonated with them and they just want to follow along?
Yeah, if you guys want to give me a follow, I would very much so appreciate it. I share a lot of educational, but also some entertainment content on there for new moms to be. And you can find me on TikTok, Instagram, Facebook, YouTube, all of the above, just at nurse_Sydney. So it's the same for every single platform, but you can find me there.
I
Yeah.
love it. You're doing it all. I
Yes.
strive to be like you and Nurse Sydney.
Yes.
I really do. All right. Well, thank you so much for being here. Listeners, thanks for also being here. We've really enjoyed this conversation. I'll see you next time in the next episode. Until then, connect with me on Instagram and TikTok at Tranquility by HeHe. Bye.
Bye.
Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye.